This week, a cholera outbreak in Nigeria's central North Benue state has claimed 30 more lives. The epidemic is reported to have caused more than 100 deaths in the country. The latest infection struck Zamfara state, where residents began drinking water directly from the streams and untreated wells after a main water pipeline was forced to shut down. The disease has now spread into southern states within a few weeks as a result of poor hygiene.
Take, for instance, the culture of dumping of refuse in drains, for instance. For a lot of the people, they don't appreciate that the tonnage of refuse that goes into the drains, even in some of the streams or tributaries of rivers around Lagos, is a major health hazard.
As the nation's population and poor sanitation continues to grow, Nigeria remains vulnerable to further cholera outbreaks. Following the outbreak, the health minister has asked all federal health facilities in the country to provide free services to cholera patients.
Cholera is a communicable disease that, simply put, if there are poor sanitary methods, now in this part of our world, the developing world, there are still issues with environmental sanitation in terms of people's idea of maintaining basic sanitation practices. The kind of climate that we have, a tropical climate, where when you have rainy seasons, which we've been experiencing of late, it will also enhance the spread of cholera.
Cholera is seen as an acute disease. Acute in the sense that it spans between 1 to 6 hours. Someone may have a cholera by morning, by nightfall, is already dead. And one of those things that leads to death is due to the severe water derangement, because individuals who end up coming up with cholera start vomiting and stooling. And when you vomit and stool, you lose a lot of body fluid and also body electrolytes. And you can easily have a derangement of the body electrolyte, and this can rapidly lead to death.
In recent years, cholera incidents in Nigeria and the entire West African states have been on the decline. But the poor sanitation, climate change, and an increase in rainfall, the disease has been making a comeback. Robert Soy, CCTV.